Today is the official start to flu season, but this year, of course, it is not just regular influenza people are hoping to avoid, but H1N1, the infamous swine flu. According to the CDC, 27 states are already reporting widespread swine flu cases. And as ABC's John McKenzie reports, doctors are hoping they can vaccinate as many people as fast as they can.
With the H1N1 swine flu now widespread across the country, the new vaccine cannot arrive fast enough. It's already been tested, and now in what amounts to the most ambitious influenza vaccination program ever mounted in the U.S. Hospitals and clinics, schools and doctors' offices will begin receiving their first shipments this week. 600,000 tubes of nasal spray vaccine, 6 to 7 million doses of injectable vaccine. Another 40 to 50 million vaccine doses should be ready the following week. Each state will decide where exactly the supplies will be shipped. But who should get the first vaccine batch is clear. Healthcare workers, children, pregnant women, and people with chronic health conditions such as asthma, obesity, or diabetes, who are at higher risk of complications from the flu.
It'll be a little bit chaotic. If they want to get it from their private physician, they'll have to make a call, and maybe more than one call to find out if their doctor has it.
But many Americans are anxious about this new vaccine. A recent survey finds that about 6 in 10 adults are not certain they'll get vaccinated, and about 4 in 10 parents are not certain they'll get their children vaccinated.
No, I don't think I'll get the swine flu vaccine. I'm not terribly concerned about getting the swine flu.
I spoke to my doctor, and right now there's not enough background information on the vaccine.
This vaccine is produced exactly the way the annual seasonal vaccine is produced. We're very secure about how it was produced and how it was tested. This is a safe vaccine, and it's going to be very effective.
With the first shipment of vaccine about to arrive, it's clear health officials still have to sell it to many skeptical Americans. For Good Morning America, John McKenzie, ABC News, New York.
And our senior health and medical editor, Dr. Richard Besser, is here this morning. Nice to have you on the weekend program for the first time. Let's clear up some of the confusion here, because you heard some of it in the piece there. 4 in 10 parents saying they're not sure they're going to get this for their kids. Why should you get the vaccine for your children?
You know, I take this flu very seriously. While many people are seeing friends who have the flu and it's mild illness, we're also hearing reports of children who were healthy one day who get this flu and have died. I also think that it's important that we don't overplay what we think we know about this flu. When we look back over history at pandemics, at times the first wave that comes through is mild, and then what comes after that is much more severe. So I take it seriously, and I think that, you know, as a parent and as a pediatrician, if I can keep a child from getting an illness that will keep them out of school for 3, 5, 7 days, that's doing something.
And there's also the argument that if you don't do it, you're jeopardizing everybody. I mean, if we don't all do it, there's no protection of everyone, right?
That's, I think, an important reason why I'm going to get vaccinated and my children will get vaccinated. Most people have a mild illness. There are certain groups. Pregnant women is one group. Last week, the CDC reported 100 pregnant women who were sent to the intensive care unit and 28 who died. If we all get vaccinated, we protect them from getting this infection.
Our medical unit reached out to pediatricians, obstetricians, primary care physicians. About 70 have responded so far. And I really want to note that most of those doctors said, yes, I'm advising patients to get the vaccine. But we know that anecdotally, a lot of pediatricians, my own included, have said to their patients, I don't think we should do this right now. Mine said, because why not just let the kid get sick and develop a natural immunity to swine flu? That might be better than the shot. Can you help us understand what are the mixed messages we're getting?
I think that there are 2 things that are going on. One is there's a misconception that this vaccine was developed in a way different from the flu vaccine every year. And it was the same methods, the same production methods, and the same testing that's done every year for coming up with a new flu vaccine. The other point is that people put this in a different category than other infections. I used to have parents who would say, I'd rather my children get the chickenpox than get the chickenpox shot. And then when I could explain, well, every year there are hundreds of children who have brain swelling and children who die from the chickenpox, they're like, really? I thought the chickenpox was all mild. And that idea that this is all mild is out there.
And as far as you're concerned, very quickly, it is safe.
This vaccine is safe.
Okay. Dr. Besser, thanks for clarifying. Appreciate your time.